I'm Dr. Beryl Okose. I serve at the Kenya Hospices and Palliative Care Association as a program officer. In my capacity, we run programs that are palliative care oriented throughout the country. The Kenya Hospices and Palliative Care Association is the umbrella organization for palliative care units and hospices throughout the country. One of the things that we do is support the hospices and palliative care units in accessing essential medicines in palliative care to be able to serve the patients that are in need. We had a really enlightening session today. We were discussing matters Social Health Insurance Fund and the Social Health Authority Act that caters for health financing in Kenya for the patients, for all patients essentially. And as you know, in our constitution, every Kenyan has a right to quality healthcare. One thing that stood out in the discussions is we have moved from the NHIF system of funding to the SHIF or SHA system of funding, but it is not adequate to cover for all the costs that are required for a patient in the whole continuum of cancer care management. You find that we may have some services either in screening. Actually, we do not have most services in screening being catered for or rather being covered by SHIF or SHA. And then even in diagnostics, for us to get an accurate diagnosis so that we can get the right management, we do not have enough coverage for all the tests that are required. Take, for example, if it is an MRI, you find that you only get 2. If it is a CT scan, you only get 2 per household. And we know in the management that you will require to have the staging CT scan, and you will also have to have evaluation tests. So basically what we're saying is we would advocate for a wider coverage, and as opposed to having household coverage, we advocate for, if you're having 2 contributing members in a family, then let them have separate coverage as individuals and not just banking on a certain maximum figure per household, because that means that if in the unfortunate situation where we're having more than one person with an oncological condition, then all of them will not be able to be covered under SHA and SHIF. The other thing that we're grateful for in the palliative care community is palliative care services were previously not covered under NHIF, but they've been brought on in the SHIF, and we are happy. It's a step forward for us, but we advocate for a wider coverage so that every person has access to these services which are essential. The third thing is the availability of essential medicines in palliative care, and of course in cancer management. We know pain is a common factor or a common physical symptom in patients with cancer, especially in advanced cancer. And one thing that has been persistent is the lack of oral morphine solution, which we know is an essential medicine, and it's also a key indicator of palliative care service provision in a country. So we would recommend, and we highly recommend, that the availability of these medications are covered in SHA, the accessibility is there, and that we offer the quality services to our patients to the best of our ability.
Thank you.